This is Outnumbered, and I'm Melissa Francis. Here today is Harris Faulkner, host of Kennedy on the Fox Business Network, Kennedy herself, syndicated radio host and Fox News contributor Leslie Marshall. And in the center seat today, Fox News medical A-team member Dr. Mark Siegel, professor of medicine at NYU Langone Medical Center, and an expert on quarantines. And he is outnumbered. We're going to get to that in a second. You have to kind of believe everybody's doing the best they can, and we're holding ourselves to a high standard. Is that fair or no?
I think that both sides made this political in the beginning, and that's shameful because there are people that have lost their lives in this country and throughout the world. I think another problem is in the beginning we had things coming out of China, not just information, but also vaccination, potentially, medication, and not to be trusted. And then I would agree, you got to go to the private sector. I was at Quest the other day for a blood test, not to do with coronavirus, and there were lines of people that wanted testing, and you could see the Quest workers freaking out because they didn't have the tests, they didn't have the answers to the questions, and I do feel we dropped the ball there. We should have tried to get ahead of it, especially looking at this is a virus, and doctor, correct me if I'm wrong, this is a virus that has spread faster than SARS, faster than bird flu, faster than Ebola, so containment is a huge issue.
I hear you. That's definitely the case, but the thing that I would put up, and Leslie, you might have some objections with this, is the idea that, you know, when they say they don't want to do the payroll tax cut, that's something that would benefit everybody right away, except for them, because it's less of our money in their pockets to spend. And the things that they like to do is, like you said, the giant fire hose of cash drowning people. The things they don't like to do is let you keep your own money. If you think about that and what they're objecting to, it falls in those categories. They love the fire hose. They hate to let you keep your money. Leslie, you disagree with me?
Larry Kudlow said that a stimulus isn't going to work. And Democrats are saying a stimulus isn't going to work, and Republicans are saying it is. They certainly have switched around. Not all Republicans. What I think we need to do is, instead of have this huge stimulus package, we need to look at areas that are prioritized, okay? And areas where we're both in agreement, we being Democrats and Republicans. Both sides agree with the president and his administration. You need to have paid leave for workers. Both sides agree you need to have free testing. Let's start with that out of the box and then move forward from there.
I totally agree.
Let's
100%.
Sanders also earning endorsements from some big names himself, including civil rights activist Reverend Jesse Jackson. The senator hoping for the kind of much-needed boost he got back in 2016 when Sanders pulled off a stunning upset against Hillary Clinton in Michigan, and he was down by the same margin, 20 points in the polls right before Election Day there. So, Leslie, let's talk about this a little bit. It's interesting because Senator Sanders has to go after Joe Biden in a very specific way. He can't be too personal, he can't be too mean, but what he's saying, he's contrasting the amount of time he spends in a stump speech, which is closer to an hour, with Vice President Biden, which is roughly 7 minutes. Do you think it's working?
No. I mean, on Super Tuesday, Joe Biden, without any money or showing up in certain states, you know, just came out a front runner. And you can't trust the polls. He's 24 percentage points ahead in the latest polls in Michigan. But this is really an interesting state when you look at what happened in 2016, not just between Bernie and Hillary, but also in the general election. Trump only won by less than 10,000 votes. Hillary didn't appeal to the rural workers and to the blue-collar working class, specifically male blue-collar working class.
It's very different this time around.
I think it's different this time around. I think Joe Biden can appeal to that sector. But for both Biden and for Bernie, the interesting thing is when you look at areas where they're strong, you know, Bernie with the youth and Bernie with Latinos, you have a very low percentage of Latinos in the state of Michigan, and you have a low percentage of African Americans in the state of Michigan. So this is going to be who can win those rural white voters and those suburban white voters, especially the educated and the female suburban white.
All right, but no one should count on anything because the polling. So glad you brought that up because Bernie brought it up during last night's Fox News Democracy 2020 town hall. He was trying to make the case for Medicare-for-all by using the coronavirus as the big propagandist reason. Watch.
When I talk about healthcare being a human right and all people having healthcare, the coronavirus crisis makes that abundantly clear as to why it should be. You got millions of people in this country today who may feel that they have a symptom, but you know what? They cannot afford to go to a doctor. And then they're going to go to work.
All right. Leslie, there's been a big logjam at the CDC. I don't know if that's necessarily making the case for the federal government when they've already botched quite a bit of this.
Look, I've said it before and I'll say it again. It's not just the numbers economically, it's the numbers regarding votes. Senator Sanders knows in the current composite of the House and the Senate, he would not have the votes for Medicare for all. Even if you look at what could happen in the general election, still probably not going to have those votes. So if you're promising something on the one hand that the numbers don't add up, secondly, when you're Medicare for all, my husband's a physician and he's like, Medicare for all.
I don't know a lot of
Medicare isn't the greatest plan in the world. And then, of course, there aren't the votes. So this is an area that we saw from Super Tuesday.
Here's the problem, and I think this is why you've seen some of Bernie Sanders' support. He shed some of that recently because people are looking at these numbers, and you realize that if you're really talking about $3 trillion a year, and even if he's talking about a Wall Street speculation tax, there's no way you're going to come up with enough revenue to cover that. So you're deficit spending. So when we deficit spend in this country, what do? We turn to China and borrow a bunch of money. Do we really want China paying for our health care?
Sanders, and we saw Elizabeth Warren falter with this too, is not pleading with voters based on those facts. It's an emotion. And I know that he's no longer really calling it a revolution. He's calling it a movement.
Yes.
Which could be a medical term. We won't get into that. But, you know, you are trying to reach people through something that is an intangible. It isn't those facts that you're talking about. So I come back to you, Leslie. You talk about those people in those areas that are going to have to vote for Bernie. What makes you think that they will?
I don't. I believe the poll. I believe Joe Biden is up 24 percentage points. I believe Joe Biden will sweep Michigan and the other states tonight.
They're not going to give
Washington
up.
State?
Not Washington State, the majority.
With your help, it's the closest we've ever come to universal coverage in America. There are people alive today because of what you did. There are 135 million Americans whose pre-existing conditions are now protected because of what you did. Republicans will keep trying, both in Congress and in the courts, to rip away the care that millions of Americans rely on and to raise costs for millions more.
Former President Obama defending his signature health care law ahead of the 10-year anniversary of its signing and accusing Republicans of trying to take away health care from millions. The health care issue looms large as 6 states hold primaries or caucuses today. Joe Biden has proposed strengthening Obamacare while Bernie Sanders is pushing Medicare for all. Meanwhile, the Supreme Court recently said it will take up a case likely to decide the fate of Obamacare, but a decision is not expected until after the November election. Harris, I want to ask you, with Republicans, talking negatively and poo-pooing Medicare for all, and also Obamacare, the Affordable Care Act, wanting to repeal it, don't they need to come up with a better plan? This seems to hurt them in every single election we're seeing from exit polls.
This hurts everybody in every single election. And the only time it didn't most recently was the midterms, yet we still haven't heard from Democrats what they would do to shore it up. They don't want to replace it. They want to shore it up and make it better if they can, Obamacare. So I think a pox on both their houses, if you will, Republicans and Democrats. And now we're in a crisis that involves the healthcare system. So it would be really helpful if somebody had something other than talking points and some vision. And I mean that for everybody. Doctor?
I think that getting rid of the individual mandate helped a lot, because that's the part that we doctors found most odious about Obamacare. That forced people to buy a policy they couldn't necessarily afford with a restricted network of providers that had to be supplemented heavily. Now they have more choices being added to the system. I was always a fan of the Medicaid expansion, which brought health insurance to millions of people, and I'm sure you supported it too, who didn't have it.
A lot of governors didn't like that.
And a lot of governors, well, some governors did like it, though. So the governor of Arizona liked it. Places where there was a lot of rural areas where those clinics are, people liked it. I was never against it. So I think, and for all the critics of the Republican Party, premiums have stayed pretty stable without that individual mandate in there. So I think if we can just add in more private options, I think we're in better shape than we were
If you wipe
before.
it away, Leslie's question is, don't they have to come up, though, with a plan to replace it?
Yeah, but reality is it's not going away. I don't think the Supreme Court gets rid of it. I think it stays. It's an existing law. The chances are it stays. how do you fill the holes with a better solution? I don't want to see the public option, and I don't want to see Medicare for all, but I could see more and more options being added.
What annoys me about this conversation is that there are a bunch of ways that we could make it better, and yeah, I feel like politically nobody wants to solve this problem, which is ridiculous because, as Harris said, you always get elected saying nobody fixed this and I'm going to do it. That helps, and then whoever's already in office didn't fix it, whichever party they're in, and they get punished for it. There are a bunch of things we could do. We could, let people buy across state lines. I think that if you took all of the government funding,
Medicaid, you could do
target it at the people who are very sick, that small group that uses all of the health care. We could point the money at them.
Skinny plans.
Yeah.
Can I just say something very quickly? President Obama is blaming Republicans for dismantling Obamacare. He should be looking at Democrats, because that reached critical mass in the Democratic caucus, where a majority of members signed on for Medicare for all. Medicare for all is an admission that Obamacare.
That's why I said
talk about it later, because
box
we
on
have
both
to
their
go.
houses.
We're going to have more Outnumbered coming up in just a moment. Don't go away.
Yes.
And so here's the part we haven't discussed on the show. The only thing we didn't get to is surge capacity. In other words, if people get sick, can the hospitals and the medical sector and clinics and doctors and nurses come together and take care of them? That's going to be an enormous challenge.
Can they?
Well, it depends on how many cases. Our hospitals are full in this country. Some of them are closing. We need to really ramp up, and it will take great dedication and cooperation, public and private.
And that's something that he has to do. I'm glad you said that. There has to be assurance to the healthcare community and to the facilities that the government has their back. I would add that to the other steps I said to put out there before an entire stimulus package.